Thank you for introducing me. Thank you for a very kind invitation to join this meeting. My name is Dr. Pinson. I come from Yogyakarta. Today, I will give a discussion about the role of electroneuromyography or ENMG for electrophysiological examination in clinical neurology. This is my curriculum vitae, and this is what happened during online course. But we are very happy that we can join together in this meeting to learn each other and have a discussion about this interesting topic. I will divide my talk to two sub-main topics. The first is the role of electroneuromyography or nerve conduction study for peripheral nerve disorder. And my second talk is about the role of EMG or electromyography for biofeedback therapy. Why do we need electrodiagnostic study? This is very important question. In the clinical setting, in patients with suspected neuropathy or myopathy, the problem in the nerve or the problem in the muscle, the history and neurological examination will provide information about the general features. But sometimes it is not enough. Why? Because only based on the history and neurological examinations, we cannot define the pathology changes and the distribution of the nerve involvement or the time course. So, ENMG, the electrodiagnostic test, will allow us and give us more detailed characterizations of the nerve problem and the muscle problem. This is the view of the peripheral nerve system. We have large fiber and we have small fiber. Motor will be considered as the large fiber that will use to muscle control. Sensory and autonomic nerve will be considered as a small fiber because it contains C fibers, either myelinated or unmyelinated C fibers, and also A delta fibers. Anything that happens in the peripheral nerve system will be considered as neuropathy. So neuropathy will be the pathology changes in the peripheral nerve system. This is the basic principle of ENMG or electrodiagnostic study. You can imagine this is the nerve, neuromuscular junction, and this is the muscle. If you give any stimulus in the nerve, so there will be recorded in the muscle as a action potential. So if we have a recording site here and we give any stimulus between this site to the recording site, so we will obtain the motor unit action potential. The time between our stimulus and the appearance of the action potential, we call it latency. Latency commonly is on milliseconds. So if we have 2 points of stimulus, so we can measure the distance between the 2 points of stimulus. And then we will divide the distance to the difference of the latency between these 2 points of stimulus. And then we will obtain the nerve conduction velocity. Yeah. There will be a normal value for every nerve, and then the only thing that we do in the examination is to compare, to compare the value of the patients with the normal value. So this is the examinations. We have a detailed neurological examinations. It's online, but sometimes it's not enough. We have to examine the function of the nerve with neuromyography. This is the machine, the ENMG machine. So this is the basic principle. If you give the stimulus here, and this is the recording side, there will be compound motor action potential. There will be the latency between the stimulus to the appearance of the CMAP. Because the CMAP, the motor unit, is larger than the sensory unit, so the action potential on the motor will be larger compared with the sensory. So anything happen between the nerve root to the muscle, we will appears on the recording side. For example, if there is a block here, and if we stimulus in the side proximal to the block, so we will get a conduction block appearance. It means that if we have a conduction block appearance, it means that there is something happen between our stimulus point to the recording side. And then the detailed history taking and the detailed examination will refer to the what caused the block. This is the importance of electrodiagnostic study. For example, you have a patient, 45 years old female with numbness and tingling in the first and third finger of the left hand, atrophy and the thenar muscle. The clinical question, is it carpal tunnel syndrome, or is it the pathology in the C5 or the 6 nerve root pathology, or it could be something else? How severe? How is the prognosis? Only based on the history and neurological examinations, sometimes we cannot make sure about the severity and also the prognosis. But with electrodiagnostic study, for example, in this case, we can compare with the normal value in the right side and also the affected side, the left side. And based on the electrodiagnostic study, we find that the latency in the left median nerve prolonged. So in this case, it is carpal tunnel syndrome. And because of the sensory median nerve diminished, it means that the severity, I think, is moderate to severe in this case. So based on the electroneurobiography, we can know what is the pathology, what is the diagnosis, and also we can predict the prognosis of our patients. ENMG give data on the peripheral nerve systems, functions which may be used to provide the information to the clinicians about diagnosis, about the description of disease state, is it old or new, dynamic, static pathophysiology, and also in some cases, for example, CIDP, chronic inflammatory demyelinating polyneuropathy, we can make a longitudinal monitoring of disease with multiple studies. Is it progress or not progress? And also to give an advice on the prognosis and management based on the test result and disease detected. So this is the function of ENMG in the peripheral nerve system study. The basic principles of electroneuromiography is that the applications of the depolarizing square wave electrical pulse to the skin over a peripheral nerve will produce a propagated nerve action potential recorded at a distant point over the same nerve. So, if we give a stimulus, there will be a compound muscle action potential arising from the activation of the muscle fiber in a target muscle supply by the nerve. And then, in both cases, they may be recorded with surface or needle electrodes. In the clinical setting, we use surface. We use a needle in some particular cases, but commonly we use a surface electrode. The nerve conduction studies can be used either in the motor studies or sensory studies. In the motor studies are performed by electrical stimulation of a nerve and the recording the compound muscle action potential, the CMAP, from the surface electrode overlaying a muscle supplied by the nerve. For example, if we would like to study the median nerve, we will place the recording site to the abductor pollicis brevis nerve. And then we make a stimulus along with the nerve, the median nerve. And then we can calculate the latency, and we also can calculate the compound motor unit action potential, and also we can calculate the nerve conduction velocity. And then anything happen during the long nerve, the median nerve, we can find where is the pathology and the pathophysiology of the pathology. And also we can describe the prognosis. The nerve conduction test also can be used for the sensory nerve action potential that obtained by electrical stimulating sensory fiber and recording the nerve actions. And the stimulus must be supramaximal. The recording can be orthodromic or antidromic. Orthodromic refers to the distal nerve stimulations. Why? Because in the sensory nerve, it will be ascendance, not descendance. So we give the stimulation, the distal nerve, and then recording is proximal. But we can also use the antidromic, that is a reverse. It means that the recording site is on distal, not in the proximal side. And then we will obtain the sensory action potential. With the electrodiagnostic study, we can obtain the information about the pathology. It will affect the myelin or the axon. The axonal pathology will be more severe than the myelin pathology. The loss of myelin thickness will cause the nerve conduction slow. And in the severe enough case, will be conduction fail. It means the conduction block. So the conduction block refers to the myelin pathology. Yeah. So in the myelin pathology, the nerve conduction velocity will become slower and slower. In the more severe case, it not only affects the myelin sheath, but also in the axon. So in the axonal neuropathy, the greater reduction of the compound muscle action potential amplitude. So the amplitude will be diminished. So we can get an information with the electrodiagnostic study is affect only the myelin or is also affect the axon, or it mixed type. It affect the myelin, also the axons. And this information is very important to give the information to the patient about the prognosis. My second talk is about the ENMG for biofeedback therapy. We can use the ENMG machine for biofeedback therapy. Why? With ENMG, we can record the activations of the muscle. So we can give the information, objective information, detailed information for the patients about the contractions of the recording muscle. We can use ENMG for biofeedback therapy for chronic pain. We can use ENMG for biofeedback therapy in the tension type headache. We can use it for fibromyalgia. And also we can use it to improve the paretic muscle. For example, patient with spinal cord injury or patient with stroke. We will have a detailed discussion after that. So ENMG neurofeedback, ENMG biofeedback is the process of measuring, of transforming the site physiological information from muscle into the visual and audio signal. In common, we use the visual signal. The EMG biofeedbacks can be used to increase activity in weak or paretic muscle, for example, in patient with stroke. Then we measure the contraction with EMG, we get a detailed information, objective information, and then we set the target. We set the target, and then we give the patient biofeedback. This is your target. This is you now. And then, yes, we have to achieve the target together. Or it can be used to facilitate or reduction in tone in a spastic one or in the very spasm. For example, in patient with tension type headache or patient with fibromyalgia, there will be spasm, and then we can use EMG for give the information, the biofeedback. This is the spasm. If you relax, we give the relaxation techniques, and then the spasm will be reduced. So EMG biofeedback provides the patient and the therapist with objective information about the subject's muscle activity in real time. For example, like this. When we ask the patient to squeeze in your hand, then we get a detailed information about the muscle contractions in this recording site. And then the patient and also the therapist can see objective information about the contraction. EMG user directly benefit from the instant feedback that increase the patient's self-awareness of the muscular activity under direct conscious control. So in patient with stroke, for example, they have the paretic side, and then we give the training, we set the goals of the training, and then we achieve the goal together. By using surface EMG biofeedback, the therapist can identify individuals' suitable movement for reliable muscular activations. And then we ask the patient to perform specific movement. Squeeze your hand, for example. And then the surface EMG is used to visualize the muscle contraction during training. And then we get the information. The patient will know the information objectively. That sometimes it is not visible or even palpable at that early stage of the reinnervation. So if the reinnervation process begins and we can get the detailed information about the muscular activations, it will give a very valuable information for the patient and also for us as the therapist or as the physicians. So EMG neurofeedback also used for tension headache to relax the muscle through the electromyographic feedback. It can be also used for returning standing balance through visual feedback, or for locomotor rehabilitation to promote resuscitation of appropriate gait. So this is the use of the EMG neurofeedback. I will give you two examples, EMG neurofeedback for tension type headache. This one, electromyographic biofeedback, give feedback of electrical activity from muscle of the scalp, neck, and sometimes upper body in this patient, very tension, and then we use it to teach the patient to self-regulate muscle tension by have the relaxation technique to reduce the spasm. And if you can see, this is the evidence that the electromyographic feedbacks combined with the relaxation technique will provide greater reductions of the spasm compared with the medication alone. So there is an evidence that EMG neurofeedback is effective for tension type headache. EMG neurofeedback also can be used for the paretic muscle. For example, in patient with stroke, EMG neurofeedback will facilitate the improvement of accuracy during the rehabilitation session that involve the patient in their own rehabilitation tasks. We can set the target. In biofeedback, a patient can self-identify his or her muscle activity through the conversion of the EMG signal to visual or auditory signal. And then the patient can control and regulate the muscle activity themselves. Yeah. So this is the evidence also, the benefit of the surface EMG biofeedback compared with the control. So if we can see in the homeopathic side, the improvement either in the upper limb and the lower limb using surface EMG biofeedback is greater than the control. So EMG neurofeedback is beneficial for patients with stroke. So this is the conclusion of my talk. We can use EMG that can be extremely useful in the peripheral nerve disorder for localizing the lesions. Where is the lesions? And also to determine the pathological process. Is it involve the myelin or involve the axon or both? That responsible in peripheral nerve disorder, the nerve and also in the muscle. And we can use ENMG for EMG neurofeedback, were used to increase activity in weak or paretic muscle. We set the target, we can record the muscle activity, and then we try to achieve it. Or it can also be used to facilitate a reduction in spasm, in tone, in spastic one, and also in pain reduction. And now we have the evidence that the EMG neurofeedback is beneficial as a joint treatment, either in paretic one, for example, in patient with stroke or spinal cord injury, and also in patient with pain, especially a chronic pain, tension type headache, and also fibromyalgia patients. Thank you very much for your very kind attention.